Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. Joining us is a highly experienced plastic surgeon, best known for being a rhinoplasty expert, Dr. Armen Vartany. Dr. Vartany is double board certified by the American Board of Plastic Surgery and the American Board of Surgery. A member of the medical staff at St. Joseph's Medical Center, Dr. Vartany is also the founder and medical director of Vista Outpatient Surgery Center in Burbank, California. Hi, I'm Amy, and we are live in the studio today with Dr. Vartany, who is going to give us some insight on rhinoplasty. How are you today?
Very well, thank you.
All right, so we want to get a little background on you before we get into the questions. So tell us a little bit about your journey to plastic surgery.
So I went to college at Tufts University in Boston, and then I went to medical school at the same place at Tufts University, and then I continued. I decided to go into general surgery. I did a residency in general surgery for 5 years.
Wow.
And then I did specialize in plastic surgery. So I did a total of about 8 years of subspecialty before getting to practice plastic surgery.
Incredible. It's a lot of time.
It's a lot of time. It's a long time, but it's fun.
Yeah. What about your hobbies? What are you doing when you're not working?
Well, nowadays, what I do, my favorite hobby is spending time with my children, which I don't get to do much because I spend so much time in the office and in surgery. So with the weekends, I devote completely to spending time with the kids.
That's wonderful. Where is one of your favorite places to visit?
As far as
like a
traveling,
vacation? Yeah, travel.
Well, we actually traveled to Europe, and my favorite place is Greece. Greece, yeah. I love the food. I love the people. It's just like going home for me.
Oh, wonderful. Wonderful. So you're from there?
No, I'm Armenian.
Okay.
And Armenian and Greek cultures are very similar.
Okay.
And so, although I love going to Armenia, but going to Greece is like it feels like home.
Does it?
Yes.
Wonderful. Do you have an embarrassing moment you want to share with us? One you can think of?
Embarrassing moment?
Not to put you on the spot, but right now? Okay, we'll take it. You know, I got to tell you, that's the first time we've heard that, so I appreciate your honesty. What about your most interesting case? Is there one that kind of stands out from the rest?
Well, my favorite surgery is doing rhinoplasty.
Okay.
So I think I love that surgery because it's every nose is different.
Right.
So every time I do a rhinoplasty, it's customized surgery for that nose. It's not one type. It's not one
size
fits all type of thing. Yes.
Okay.
And I think and the most interesting cases in rhinoplasty are the secondary rhinoplasty. Secondary meaning someone who's had surgery before and hasn't gone well, and you try to fix it or do it, the best you can to fix what was done wrong the first time.
I bet that is interesting. You're fixing someone else's work.
As well as scar tissue. You don't know what you're going to find when you get in there. And one patient I remember, her nose was completely. Her nasal cartilage on the tip was completely gone. So when I opened it, there was nothing there. And what I had to do is take cartilage from the rib and reconstruct the nose. And it was a very satisfying surgery because I thought, it was very complicated, difficult, but satisfying.
Right. So what would you say then is the most rewarding part of your job?
I think the most rewarding part is the difference I'm making people's lives.
Of course.
Especially with rhinoplasty, you change the self-confidence of a person. The way they look at themselves, the way they see themselves, the way other people see them, and I think it makes a big difference in their personality, in the way they look at life, in the way they see themselves.
Right.
And it's something that lasts throughout their lives.
All right, well, let's move on from that.
Okay.
You mentioned rhinoplasty, and that is what we're here to talk about today. So let's get right into it. What is it, and what can the procedure treat or correct?
So what is it? So rhinoplasty is nose job.
Right.
So when you're trying to improve the appearance of the nose.
Okay.
And the nose has several components. Has the tip, has the bridge, has the width. You think of it as just a nose, but I see it as different components. And so you try to improve those things. And someone may have a straight bridge but a thick tip, or a wide tip, or someone may have a nice tip but a hump or a wide wide bridge. So you're trying to improve the cosmetic appearance of the nose.
Okay.
And the nose makes a big difference in how you look, because it's right in the middle of your face.
Right.
And usually once you do a rhinoplasty and improve the nose, that's when the beauty of the eyes or the lips or the smile come through, more distinctly.
Right.
And the other part of rhinoplasty, I should say, is the breathing part. So sometimes in addition to the cosmetic improvement, someone has a breathing problem too. It could be from congenital; they were born with a crooked septum, causing obstruction, or it could be after trauma, they've broken it. So we do both at the same time.
What makes someone a good candidate for rhinoplasty?
So the first thing, so someone to be a good candidate is to really want to have that change.
Right.
It could be a very small change that really bothers the person, and they'll be happy with that small change. So I always want someone who has thought about it, who has considered it for a while, and really wants to undergo that change. As far as physical characteristic of the nose, what makes a good candidate is someone whose nose doesn't have the skin is not very thick.
Okay.
Because then when the skin is thick on the on the tip of the nose, it's not easy to make a big difference in the appearance of the nose.
Okay. What is the average cost of rhinoplasty?
Rhinoplasty cost is probably is the tenth. The average cost is, we would say, $10,000 to $15,000.
Okay.
That includes anesthesia and facility and the entire cost.
Are there cases where it may, or part of it may, be covered by insurance?
Yes. So if there is a breathing problem, the breathing problem is not a cosmetic part, so that's covered by insurance. But there's a caveat to that most insurance companies have a lot of limitations as far as deductible, copay, in-network, out-of-network. So we have to, check everyone's benefits and tell them if it would be covered or not.
Gotcha. Got to do your homework.
Yes.
All right. So are there payment options available for, let's say, someone who absolutely insurance is not going to pay? It is cosmetic, and someone wants this procedure but maybe doesn't have the money lying around, or doesn't want to pay cash or on their own credit card. What other options are available?
Best option that we have in our office is financing, and the financing company that we exclusively work with is CareCredit. Okay. Pretty much like you financing a car, you finance the surgery.
All right.
You don't have to come up with the money up front and all at once, and you can make monthly payments, and that makes it easier.
A little easier.
Yeah.
All right, so let's say the patient has finally decided, I'm going to get rhinoplasty done, and now I have to find my surgeon. What advice do you have for them to how can they find the right surgeon for them?
So rhinoplasty is very difficult surgery for a surgeon to master. I think, it's considered one of the most difficult surgeries in plastic surgery. So it's not just finding any plastic surgeon. I think the person should find a plastic surgeon that both has the expertise. In other words, does a lot of it, a lot of rhinoplasties, and has done it for a long time and has the experience in it. Consumer, I think, is difficult to identify to find a plastic surgeon who has both the expertise and the experience. And I think the first place to start is to make a consultation. Or even before the consultation, go to the website and see if there is a large number of before and after, if rhinoplasty is featured in this person in the plastic surgeon's website or Yelp page, I should say. So you want to go to someone whose plastic surgery is a big part of their practice.
Right.
You don't want to go to someone who does a rhinoplasty 1 or 2 a month.
Right.
Yeah.
What about like certifications or credentials?
Being board certified in plastic surgery, I think, is the minimum qualifications that you want in your plastic surgeon. It's important to know that there are doctors out there practicing plastic surgery who are not board certified in plastic surgery.
Doctor, are you board certified? I forgot to ask you. And how long have you been practicing?
Yes, I'm board certified in plastic surgery, both in plastic surgery and surgery. So I have 2 board certifications, and it's very important for a patient not just to ask, are you board certified, but what are you board certified in?
Right.
Because I could be board certified in internal medicine and say, yeah, I'm board certified.
True. Good point.
So the way to find out what exactly the person is board certified in is to check the American Board of Medical Specialties, AABMS, American Board of Medical Specialties. That's the sort of organization that all the board certifications go under. And online, you can go to their website and find out if someone is board certified and in what specialty they're board certified.
Okay, good to know. And how long have you been practicing?
I've been practicing about 20 years. Plastic
20
surgery,
years.
about 20 years, yes.
Wow. So the patient finally finds their surgeon. What do they ask in the consultation? What's important to find out?
Well, in the consultation, you discuss. I discuss with the patient what they want, and the patient tells me what they want.
Okay.
And you want to be about on the same page with your surgeon as far as what the surgeon wants to do and what you're expecting.
Right.
Something that I do is that I take a picture and I show with digital imaging on the computer what I think. My best estimate is that the surgery will be able to achieve.
Gotcha.
And you want to when you look at that picture, you want to feel that, yeah, that looks good. That's pretty much what I want. As far as how to judge, again, the expertise of the surgeon, again, in the consultation, you can ask the surgeon, how many of these procedures do you do? Where do you do them? And again, look at their before and after pictures, and you want to see a lot of them. You want to see, you don't want to be just look at like 2 or 3 before and afters. Our before and after album of rhinoplasty is about this thick.
Okay.
So I think that indicates that surgeon does a lot of that surgery.
You mentioned you want to see how many a surgeon has done. So like per month, what's a number that someone would be like, okay, this surgeon does enough, that he's an expert? Like, is it 1 to 2? Is it 10? Is it 20?
I'd say you want to be with someone who at least does 2 or 3 a week.
And how many rhinoplasties do you do in, say, a week or a month?
So I would, in a busy time, I do about 9 rhinoplasties a week.
Wow.
Yeah, about 3 a day, 3 days a week.
Wow.
And on the slow time is usually about 3 a week, 2 or 3 a week. So on the total, I do about 150 to 200 a year.
Okay, so we know that there are risks and complications associated with basically everything. What about for rhinoplasty?
Well, rhinoplasty is a pretty safe surgery as far as complications are concerned, as far
Okay.
as risk of anesthesia complications or bleeding, infection. Those are rare.
Okay.
The complications that I would consider a complication is basically undesired cosmetic look. So if the nose is not as small as it could be or as narrow it could be, sometimes you need to do a second operation to get there. So that I consider a complication when when
Right.
you have to do it.
When you're unhappy.
Yeah, exactly, when you don't like the result.
Okay, so tell us how the procedure is performed.
Rhinoplasty is done under general anesthesia.
Okay.
So the patient goes to sleep. It takes about 2.5 hours. And there's two different ways of doing it. One is called the intranasal approach,
Okay.
where the incisions are inside the nose. And one's the external approach, where there's an incision on the outside and the skin is flipped off, and the surgery is done that way.
Okay.
So depending on what needs to be done, is a combination of shaving the bone, trimming cartilage, to rotating the tip up, narrowing the tip,
Okay.
and all these can be done both through open and closed approach.
So what can the patient expect to experience during recovery?
Recovery in rhinoplasty doesn't involve much pain, that's
good.
That's nice. So when the patient wakes up, they have a cast on their nose. They develop some bruising and swelling under the eyes. The cast stays on for 1 week, and the bruising takes another few days after that to go away. So there's not much pain, but swelling and bruising, and time off work or time off school is about 10 days.
10 days, okay.
Yeah.
And after about 10 days, all the bruising goes and the swelling calms down.
Yes, yeah. I mean, in 10 days, the bruising is gone enough that you can go out in public. You may need a little makeup, but you can go out in public.
All
But
right.
the swelling, the nose stays swollen for up to a year and a half. So
Oh, really?
Yeah, for the swelling to go down completely, and the nose to have its final shape, it takes 12 to 18 months
For final.
for final.
Okay,
Yeah.
that's good to know. That's not common knowledge, I feel like. So we kind of touched on this earlier, but what can the patient do if they are just unhappy with the results?
Good thing about rhinoplasty is that there are options in redoing the surgery. Redoing it, like I said earlier, is harder. It's a more complicated procedure than doing it the first time. But it's possible to go back in there and make the bridge smaller, make the nose shorter. So no one wants to be in that position. Neither I don't, the patient doesn't.
Right.
But sometimes, I'd say 5 to 10% of the time, that happens, that you have to have a second operation to get further improvement.
Do you make them wait a certain amount of time before you'll even consider doing a second operation?
Yes. I usually wait about a year.
Okay.
A good year for all the swelling to go down and all the scar tissue to soften, and that makes the second operation a little easier.
So when should a patient see the final results? I know you said 12 to 18 months is pretty typical.
Yes.
Is that,
Yeah, up to 18 months. It takes about
Okay.
up to 18 months for all the swelling.
and then they
swelling
look
to go
great.
down.
Well, they look
Yeah.
great in the beginning, but
Yeah.
once all the bruising,
Yeah.
the swelling goes
Yeah.
down a little bit.
Yeah, when the cast comes off, the nose looks very wide.
Wide?
Wide from the swelling, yeah.
Okay.
So usually the first 2 weeks after the cast comes off, no one likes.
Nobody likes what it
No
looks
one
like.
likes their nose from the front.
Dr. Vartany, is it helpful when a patient brings in, let's say, a picture or Instagram full of celebrity noses that they want to look like?
No, not really.
No. Okay.
No, because what I can do is improve their nose.
Right.
I can't give them a totally different nose.
Right.
I look at their face, what fits their face, what improvements I can make in their nose.
Okay. So if someone out there has decided, okay, I'm really interested in rhinoplasty. I want to see if I'm a good candidate. What advice do you have for them? What are their next steps?
I'd say the first step is to just Google that procedure online.
Okay.
And find a few surgeons in that area that specialize in that procedure.
Okay.
And just call the offices and make a consultation. 1 or 2, 3 consultations would give them a good idea of what the prices are, what options are available, who they click with, who they don't, as far as surgeon, office. And it's important also, where the surgery is done, finding all that and seeing which one works the best.
All right. Well, thank you, Dr. Vartany. We are going to move on to a lightning round. So I'm going to ask you questions, and you just pick this or that, okay?
Okay.
All right. Cat or dog?
Dog.
Hardtop or convertible?
A hardtop.
Surf or ski?
Ski.
Golf or run?
Run.
Night owl or early bird?
Used to be a night owl, now I'm an early bird.
All right. Decaf or calf?
Caffeine.
Shop in-store or online?
Oh, online.
All right. NBA or NFL?
NBA.
All right. Well, thank you again. We appreciate your wisdom.
Thank you. Thank you for having me.
Absolutely.
We learned a lot about rhinoplasty from one of the country's leading plastic surgeons. If you're considering this procedure, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. All the healthcare experts featured recommend and accept the CareCredit credit card. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Frina with CareCredit, and I will see you soon.